At the same Shed Cathedral, the requiem mass for Dr. Paul Farmer was preceded by the Archbishop of Kigali, Cardinal Antoine Kambanda. The ceremony was attended by Her Excellency Madame Jeannette Kagame, government officials, international organizations, late Dr. Paul Farmer's family members, representatives of the organizations he founded, and others. Health services and care for the poor in general are among the highlights of Dr. Paul Farmer, who was also granted Rwandan citizenship. Rutaisire Jean-Claude is 45 years old and a resident of Kayonza district, where Partners in Health, a non-government organization founded in 1987 by Dr. Paul Farmer, also operates. Partners in Health operates in different countries, whereby it promotes health and medical services in developing countries. It started in Rwanda in 2005. Rutaisire revealed that after being diagnosed with HIV in 2005, Dr. Paul Farmer hired him for 36 years. This has boosted his life expectancy and the lives of nearly 2,000 of his colleagues who are still under Paul Farmer's care.
The
following month, Paul Farmer and a group of PIH members came to Rwanda and brought medicine for the patients and said that all requirements must be met to improve the health of the patients. At the time, I was 27 years old, and he showed me that I would live a long time, even though I had HIV, which gave me hope because he immediately gave me a job in PIH, and as you can see, I'm doing fine, Your Excellency First Lady. The University of Global Health Equity, located in Butaro in Burera district, was founded by Dr. Paul Farmer, and it is in this area that the Butaro Cancer Center of Excellence was built with the participation of this professional doctor. Dr. Agnes Binagwaho, the Vice Chancellor of the University of Global Health Equity, has worked with Dr. Paul Farmer for more than 20 years, since they first met in 2002. She emphasizes that remembering and honoring him is an appreciation of his work in Rwanda.
The first time I met Paul was in 2002 in New York. It was also my first time in New York. And we were discussing the Millennium Development Goals, and during the meeting, we discovered that our vision of equity access to quality care were the same. And that's how the journey starts. Not Paul knowing Rwanda, no, but Paul working in Rwanda on day-to-day basis. We start with Rinkwavu and continue with Kirehe and continue with Butaro. So we became friends, and it's not unique. All of you here are friends of Paul, you know? I talk about my friendship, but everybody could stand up here and come and talk about the friendship he or her had with Paul.
Unparalleled medical care, even for the poor, as well as the betterment of the disadvantaged in general, are some of the things that awarded Dr. Paul Farmer a Friendship Medal by President Paul Kagame in 2019. Dr. Mhoga Tharsis, the Minister of State in charge of primary health care, also finds that Dr. Paul Farmer's efforts should be the legacy of many in Rwanda and elsewhere around the world.
Start brainstorming how to start these services. And most of people, they are saying, wow, how comes a cancer center, a very advanced services in that remote area, without patients, without clinicians, who is going to get that service there? Well, Paul says, please, I need services there, because there are people who are suffering. And in July 2012, we started the cancer center. But to tell the truth, none of us, I'm saying the hospital staff, I think they are here, those who were at that time, has any expertise in the field of cancer. So, but with that good collaboration, connection from Paul Farmer and the others, we made it.
Paul Farmer was an American and was granted Rwandan citizenship. He was born on 26 October 1959 and died on 21 February 2022. Innocent Mugabo, RTV News.